Hi, good day. I'm Francis Odor Ibayot and I will be presenting our research topic entitled The Effect of E-Cigarettes on the Salivary Flow Rate and Salivary pH of Vape Users in Dasmariñas City, Cavite. For the background of the study, according to Green 2014, tobacco cigarette is widely consumed in the world. Tobacco was introduced in the late 16th century during the era of Spanish colonization. Tobacco smoking has many harmful effects in the body. It causes damage to the respiratory system, which could lead to COPD or chronic obstructive pulmonary disease, emphysema, tuberculosis, and many more. Smoking not only causes lung disease, it can also damage nearly every organ in the body, including the oral cavity. At present time, it has evolved to a more health-friendly access, which is the e-cigarettes, or commonly known as vape. Vape contains less harmful chemicals than tobacco cigarettes, and it is becoming the first choice for people who wanted to give up smoking. For the introduction, saliva is mainly produced by three pairs of major salivary glands, which includes the parotid, submandibular, and sublingual. Saliva plays a major role in oral homeostasis as it modulates the ecosystem within the oral cavity. It helps maintain the integrity and dental mucosal tissues and also has antimicrobial action, buffering capacity, and contributes to the mastication and deglutition. According to Ciziba and Wilson 2017, saliva contains various biomarkers which include salivary flow rate and salivary pH that are used as an indication for the observation and evaluation of normal biological processes in the oral cavity. The researchers aim to study about the possibilities that vaping or the use of e-cigarettes may have an effect on the salivary flow rate or salivary pH during stimulated or unstimulated situations of vape users. For the methods and materials, the study focused both on the stimulated and unstimulated saliva of active vape users. Salivary secretion is a complex process and its flow and composition vary greatly under different conditions. Unstimulated resting saliva is present in the oral cavity for about 14 hours a day, and it is the secretion that provides protection to oral tissues. While stimulated saliva, which is produced following exposure to a stimulus such as chewing or taste, represent the secretion during food intake and is present in the oral cavity for about 2 hours. For the observation test, persons who met the inclusion criteria were included in the study. For the salivary flow rate, it is measured from the volume of saliva every 1 minute for 5 minutes according to GADUR 2016. And for the salivary pH, it is measured by the calibrated pH meter. For stimulated saliva collection, all the participants were asked to chew orthodontic bands to stimulate saliva secretion. The following values are used as reference guide for the researchers. For unstimulated salivary flow rate, 0.3 to 0.5 ml per minute. For the stimulated saliva flow rate, 1 to 1.5 ml per minute. And for the salivary pH, 6.2 to 7.6. A pH of 5.5 or less may result in demineralization or wherein the acid begins to break down the enamel on the teeth. A salivary pH above 7 usually indicates alkalinity, and excessive alkalinity can bring about anaerobic conditions. For the discussion, the results stated in Table 1 shows a statistical difference in the salivary flow rate between unstimulated and stimulated situations among vape users. During stimulated situation, the mean salivary flow rate was demonstrated to be 0.78 ml per minute, which is slightly lower than the normal physiologic flow rate of stimulated saliva. The alteration in salivary flow rate could be related to factors such as the effect of vaping on the chemical composition of the saliva, such as bicarbonate and phosphate concentrations. When salivary flow rate is decreased, the cleansing ability of the saliva is compromised. And if this continued for a long periods of time, it will increase the risk of an individual to have caries and gingival or periodontal disease due to the decrease in the protective function of the saliva. Table 1 also shows no statistical significant difference when considering salivary pH between unstimulated and stimulated situations among vape users. This proves that the levels of salivary pH of vape users were not affected or changed statistically. The result stated in Table 2 shows no statistical differences on salivary flow rate between unstimulated and stimulated situations among non-vape users. The mean salivary flow is 0.71 ml per minute, which is higher than the normal physiologic rate of unstimulated saliva. Increased salivary flow rate can contribute to drooling if there is an inability to keep the mouth closed or difficulty in swallowing the excess saliva, and this can lead to excessive sweating. Table 2 also shows the difference between the stimulated and unstimulated salivary pH of non-vape users, and it shows statistically significant differences between the two groups. Since statistically the levels of salivary pH of non-vape users have significant difference, it may account for the alteration of the pH of saliva, either stimulated or unstimulated. Table 3 shows the comparison of results of the salivary flow between vape users and non-vape users during stimulated and unstimulated situations, showing no statistical significant differences between the two groups. According to James Dunwer 2015, side effects in using vape have been well studied by several researchers, and the majority of the side effects are mild and temporary. The use of vape can minimally cause dehydration and dry mouth, which are mainly due to the e-liquid ingredient propylene glycol, vegetable glycerin, and nicotine. Table 4 shows that there is a significant difference in the stimulated and unstimulated situations between the salivary pH of vape users and non-vape users. Statistically, the continuous use of e-cigarette may alter the normal physiologic pH of saliva, which may lead to the alteration of the pH of saliva whether stimulated or unstimulated. According to Baliga et al. 2013, if the pH is lower than 6.2 for a long period of time, it tends to be a risk factor for acidity that may result to caries formation and periodontal disease. Salivary pH above 7 indicates alkalinity and presence of oral bacteria, attack food particles, and elevate the pH. For the conclusion, normal salivary flow rate and salivary pH play an important role in caries incidence, as these are responsible for demineralization and remineralization of teeth. Since e-cigarettes are new trend and believed to be safer and health-friendly, the potential of oral health effects of e-cigarettes have received very little attention. But in this study, it is concluded that the use of e-cigarettes will eventually have an effect to normal physiologic salivary flow rate and pH. Alterations to normal salivary function may lead to impairment of oral tissues and has a large impact on the patient's quality of life. There is still the fact that e-cigarettes aerosols will contact the oral tissues first when they are at their hottest and most concentrated solution, and that it is related to the traditional tobacco smoke, resulting to the several pathogenic effects in the oral cavity. Further studies should be carried out to correlate the salivary flow rate and salivary pH. As an improvement to the limitations of this study, a sample frame of more than 15 participants will aid in verifying the results made in this study. It is also recommended that consideration of gender must be included as a variable, not just a part of demographic profile of the participants. The research aims to encourage active vape users to quit vaping to prevent its negative effect to oral cavity, such as decreasing saliva or dry mouth, bad breath or halitosis, and greater risk in developing caries.